So, one of the aspects of skilled nursing that it plays a significant role in an individual's life, especially if you're over the age of 70, is the
Hmm.
rehabilitation. It's the physical
Hmm.
therapy, it's the occupational therapy. And so, what a lot of people don't realize is that someone may have a hospitalization, they may have had to go to the hospital, and maybe it
Hmm.
was seemed appropriate for them to return home, commercial or managed. If it's Medicare within a 30-day window, a skilled nursing facility can admit them under that initial hospitalization, the three overnight, the inpatient overnight. We can
Hmm.
admit them within 30-day window and provide the therapy. There's a huge difference. So when people discharge home, maybe under home health or outpatient rehab, it's maximum 3 visits a week, and you're lucky if you'll get 45 minutes of therapy. Under skilled nursing rehabilitation, it's 5 days a week, 2 disciplines. So it's typically,
Oh.
5 days of physical therapy and minimum of 2 days of occupational therapy, depending on what the needs are.
Joining us today is Cam Jones, a passionate healthcare professional and patient advocate with more than a decade of experience in skilled nursing and rehabilitation. She has facilitated over 4,000 patient admissions and conducted more than 900 home evaluations. Cam brings a wealth of knowledge and firsthand experience helping individuals and families navigate some of life's most challenging healthcare decisions. Today, we'll explore what families and professionals should know about skilled nursing care, the realities of rehabilitation, common challenges during healthcare transitions, and how advocacy, education, and compassion can make all the difference. I'm so happy to have you here today, Cam. Thank you for just taking the time to share your story and experience with us.
Thank you for having me.
Absolutely excited about our conversation. Before we jump into today's topic, I would love if you could just tell our audience a little bit about yourself and your journey into healthcare. What first inspired you to serve seniors and patients in recovery?
Hmm. Well, I fell in love with healthcare at the age of 12, so there's that. So, and yeah, and I wanted to be a doctor. So I actually volunteered in the hospitals, my local hospital. I'm from New Hampshire. So volunteered for 3 years from age 15 to 18. So I was in the hospital environment at the age of 15, helping patients and absolutely identified that I have a servant's heart. So I knew I befriended a young cancer boy, because I would hang out at the pediatrics floor when I was a teenager. And he ended up passing away after a couple of years. And so that's when I realized it's like, yeah, it's like I'm made to be in healthcare. So I studied nursing. I didn't finish my license at the time, but I became a certified nursing assistant. And I worked as a CNA for almost 2 years in Rochester, New Hampshire. And that's when I first worked with the elderly and I just connected, So I went 10 years, I stopped doing that work, life happens. 10 years passed. I got back into healthcare just from a recruiting standpoint, staffing standpoint. Got into home care, did that for 9 years. That's where the 900 home evaluations came in, which was an amazing experience. And then I ended up getting into medical recruiting. Home health, I did for a year. And then I was recruited to skilled nursing. And what's amazing is that it just seemed to bring all my skills together. And so I worked at one facility for 4 years, and then I got recruited to La Casa via Transitional Care Center 8 years ago. And it's just been the best experience. It's an amazing company, best experience I have. And one of the reasons is because, the administrator and the company supports, I can manage my job however I want. So I am one of the managing directors at La Casa Via Care Center. And, I was hired on to be the director of marketing and business development. So, when I was hired on 8 years ago, it was a two-star building. So within a year, year and a half, 2 years, we got it to 5 star.
Wow.
Meaning, just huge changes operationally in my role, just because I've been in healthcare over 20 years in this area. I knew a lot of people at John Muir Hospital already, so this is my world, right here in Walnut Creek, Contra Costa County. And just, with my background, I have a vast, just community partners. I'm blessed, just blessed to include you. Obviously, we're community partners, and
Yeah.
it's just, it's wonderful to have a great understanding of, how everyone can help, the patients and families, when they're in the hospital. So I'm unusually very involved in hand holding with a lot of my patients. So my role with La Casa Via Transitional Care Center, I almost equate it to like a quarterback in a football game. It's like I know what play we're executing because I meet
Right.
the patients, and I review all the referrals. I understand what the doctor's orders are. There's so many doctors and surgeons I'm like personally connected with, so we just want to make
Hmm.
sure we're following through on discharge orders. And
Hmm.
sometimes they do need to be revised in one way or another for whatever reason. So I work real close with my clinical team, my nurse case manager, my nurses, my medical directors, and all the specialists that may be involved. So I'm very, very involved. So, especially when
Right.
it's needed. There's some cases that are more difficult than others. So,
Yeah, absolutely.
yeah.
Well, I love that. You just described like the whole continuum of care in your background and experience. So it's pretty awesome. And I know you in the community, obviously, we've worked together and supported each other. And I see you out there with healthcare professionals, with seniors, with family members, and you really are someone that's just a bright, shining star that is advocating for patients and really being a support. And I think that's why we trust you so much in La Casa Via and have such a good partnership with you. So thank you for that. And I wanted to kind of explain something for our audience who may not be very familiar with skilled nursing. Can you explain to us what skilled nursing is and what do you actually do there?
So, a couple of approaches, just like with the thousands of people that I've met, over the years. So, when someone has a loved one in the hospital and this is their first encounter with quote unquote skilled nursing or transitional care or rehabilitation, inpatient rehabilitation, it's I do mention sometimes there's a negative connotation, but it's like, okay, a lot of our buildings are your traditional quote unquote nursing home. So half of my building is your traditional nursing home, meaning elders, elder individuals are living there because they can't stay at home, they don't have the support system, and they truly do need 24/7 nursing around the clock because of
Mm,
their complex conditions, their comorbidities. So people seem to understand that when they have no idea, right? So, and a lot of buildings are set up like that where they're, the nursing home side. And then you have your skilled services, your rehabilitation, your transitional rehabilitation side. So we have two wings, that are strictly for hospital discharges. Individuals it's like a step down. So how I describe it, skilled nursing is like a step down from the hospital.
mhm,
So we're carrying through on doctor's orders, and a lot of people need these services because they're not able to manage at home. Even with the support system, or they may not have the appropriate support system yet. And especially these days, after the pandemic, we're noticing that the hospital they're discharging patients sooner, than they
mhm.
used to. So there is a higher level of care, nursing care needed upon discharge from the hospital. So that's where the skilled nursing setting is perfect, and it's typically needed for a lot of people. Someone could, your typical, probably the most common, unfortunately, is when someone falls and breaks a hip. We see a lot of those situations. And, that's surgery, it's pain management. There may be symptoms just from the anesthesia where someone may be a little bit more confused than they normally are. They're not able to manage at home. And so that's when it's very appropriate for them to transfer or discharge to a skilled nursing facility. And the primary goals, one, you want medical stability, right? We want to stabilize someone. We want to ensure a safe discharge home. And then it's the strengthening and recovery part. And so that's
Mhm.
where the physical therapy, occupational therapy, and then there's some people that need speech therapy. That's where that comes into play. So my transitional side, the skilled services side, that's the most significant component is the rehabilitation. So, and for those that aren't familiar, so, the physical therapy focuses in on the muscle strengthening, endurance, the gait training, getting someone, to walk again, if they've been injured.
Mhm.
Occupational therapy focuses in on the activities of daily living. How is someone going to get out of bed? How are they going to shower? How are they going to toilet? And
Mhm.
so our custom rehabilitation evaluations and program, we have a good understanding. We want to know, okay, what's this individual's routine, from just their waking hours through the day until they go to bed. And that's what a skilled nursing rehabilitation facility prepares an individual for. We're going to strengthen that person and we're going to make sure that when they go home, that they're safe to, um, get through all their activities of daily living and all those expectations. And
Yeah.
safety is number one for sure.
Yep. Absolutely. Having you guys as a partner is so important. I mean, it's funny, not funny, how the transition goes. But like you said, you've got hospital, and then comes your skilled nursing or rehab, and then typically, if being at home is not a good fit or viable, like for you anymore, then you go to senior living. And so we do get a lot of referrals
Mhm.
from places such as yours where your patient can no longer go home and we're a good fit for them. But on the reverse side, we have residents in our senior living communities, and this is across the board, any senior living organization. We have residents that end up going to the hospital at some point in their journey in senior living. And from that, again, where do they go? Go to skilled nursing, they go to the rehabs,
Mhm.
they need to get that, those muscles moving again. They need to make sure they're healthy and they can go back home. And back home at this point is back with us at senior living. And so there really is this cycle and partnership. And also it's so important for people in my industry, especially, to understand who are those trusted rehabs to go to, those trusted sniffs. Those skilled nursing sniffs, right? So who is trusted in your community, and they're not all the same. Just like La Casa Via, you started as a 2-star, you're now a 5-star. There's a lot of places out there that are 2-star, stay at a 2-star. I don't know about you, but I wouldn't
Mhm.
want my residents, my family members, I personally wouldn't want to go to a place that I can't trust, that isn't clean, that doesn't have the greatest care. Maybe the food's not great. These are all things that are important because a person's timeline in these centers, they may be a little extensive. It may be beyond what you're hoping to be. Nobody wants to be away from their home, right? So it is important that we find a trusted partner, and the Casa Villa is a great example of that. There's not too many facilities that I would say I would trust. I mean, I even will advocate in the hospital if we have a resident that's going, gone to the hospital, and I know they're going to a facility afterwards. I'll ask them, where are you going? And is this a good fit for you? And I will advocate
Mhm.
for them, and say, this is where I think you should go. Let me talk to your family and talk to you and educate you a little bit on the differences, and really help and partner in making sure they go to the best place. So knowing the differences and knowing where they're at, knowing your different facilities that are local, whether you're a family member, a senior, or a professional, like that is so, so, so important. So I'm glad you shared a little bit about what are the differences and what does that journey look like, because it's important for us all to know. Um, I want to
Mhm.
go to,
And a
what,
couple
yeah, go ahead.
Just a couple thoughts based on
Yeah.
that, is that two things that families can do if their loved one is in the hospital. They can always ask the nurse case manager or social worker, what facilities have the best reputation, because they're going
Mm,
to know where the patient's discharged to, right? Because, It's usually traumatic, if something unexpected happens in someone's life. And so someone may not, and especially if they're not knowledgeable, that's a great way to start. There's always online research as well. And then, the Medicare ratings. Every skilled nursing facility, we have audits every year, so every aspect of our operations is basically analyzed. And so, our low rehospitalization rate speaks volumes, meaning that we are very thorough with, taking care of each one of our patients, and we're making sure that it's an appropriate length of stay so that they're not going home and then they end up back in the hospital. We want to make sure, that individuals are medically stable to return home. So, that's really important to us. And
Yeah.
we go way above and beyond. So lately, like especially in the last year, I cannot tell you how many people we've assisted with initiating the secondary insurance of Medi-Cal.
Wow.
So and not many people will do that. So it's not expected of a facility, but we do that because that's most helpful to the individual, to the family, because most people are just overwhelmed and they don't know how to start the process. And, so
Yeah.
we will help them with that. And then even with discharge planning, so it's like there's a percentage, I would even safely say at least 20% of the patients we admit, they're not able to go back home. They don't have the support system. They can't afford the 24/7 home care, for the caregivers. And so we have to look at alternate options for them. And so that's when we reach out to partners like you, yourself, and, even boarding care homes in the area. And we will help, we will handhold, just from working with them, identifying that, this is the safest discharge plan for them and help them. We help them with every single step of the way, so that they don't need to worry about anything. We go as far as I dragged my social services director last month. We literally moved a gentleman out of his rental room of 15 years and we moved him into a boarding care home. He didn't have
Wow.
any family, he didn't have any support system at all because he's from another country. And so I dragged my social services like, come on, Tom. It's like we're gonna help this guy. It took us 3 hours, but we got him settled into a new boarding care home, and he's doing great. And it was the best option for him. So we definitely go above and beyond for our patients.
Yeah, I can't tell you that I've ever heard of a facility helping with the transition. So that is awesome. You're just such an amazing partner to have. Again, not just a partner because you were so good to your patients, and we see that every day. So thank you for doing that, Cam. We were talking about what that discharge process looks like, and you mentioned that family members can ask, like, what are the greatest facilities around the area? What I found is that families don't even know that they have a choice, and they just go with the flow of things. So things like this, and learning that you do have options, you have choices, you can advocate for yourself, you can advocate for your loved one, or if you have a power of attorney, like, you definitely do have options, and that's so important to know. I'm wondering if there's been anything that you've seen. Like, I've seen people just don't know they have a voice, they don't know that they can choose. Are there any mistakes that you have seen families make when they're trying to navigate that journey of post-acute care?
Probably the most concerning observation I've had is that when families select a facility that's not the best fit for their situation. So it's frustrating to encounter families that their loved ones are in another skilled nursing facility that can no longer manage their care. And
Mm-hmm.
because, the individual's not able to go home right away. And then, insurance coverage runs out or it's close to running out. And all
Mm-hmm.
of a sudden, the family and the patient, they're in this situation where, like, we don't know what to do. And it's like, that's something, you basically made not the best decision, when you
Mhm.
discharge your loved one, because you have to think if there's any sort of doubt, with the discharge plan, then you need to make sure the skilled nursing facility can manage, once that insurance, so insurance is finite, so it's like uh, managed Medicares, they typically like to end skilled nursing stays by day 21.
Mhm.
So you have to really justify, like maybe a stroke patient, wound care, a new feeding tube. Those cases may be extended longer, but realistically, managed Medicare will only cover, 2 to 3 weeks, 4 weeks max on average, which is not much. And
Yeah.
that's not going to give enough time for a patient or family to come up with a plan B. So we have
Right.
seen so many families end up in a situation where, they may not have money, to move their loved one into a beautiful community or anything like that. Or maybe they're still trying to determine, it's like, okay, what are the care needs going to be? Stroke patients. That's, we've been running a neuro program for 6 years.
Hmm.
And so our stroke patients, especially our severe stroke patients, care needs cannot be determined after 3 weeks.
No.
Stroke patients, the human body heals, all the way up to a year. So someone may need to stay with us 6 months, and most skilled nursing facilities cannot accommodate that. So that's probably
Mhm.
one of the biggest mistakes that, we see, that's very difficult to navigate through. And so it's
Mhm.
just being realistic
Mhm.
with the hospitalization,
Mhm.
the condition that your loved one is in. If there's any doubt or any question, about return home in 3 weeks, then you need to make sure that the skilled nursing facility can manage those care needs. And we commit. So, I mean, if we admit someone, I review. I review all of our referrals. I've probably reviewed over 30,000, patient referrals at this point, my 12 years being in skilled nursing. I already know what the risk is if someone not being able to go home. And we're okay with that. So we'll skill someone for a certain amount of time appropriately, and then we'll manage their care until we can determine what the safest discharge plan is going to be. So we commit to our individuals, and there are some people that end up staying on our long-term side, and it is what
Mhm.
it is. So, but not all facilities are like mine. So,
Right. Hardly any are actually like yours. Uh, so there's a big difference. We're talking about insurance and why I mean, it is just so confusing. It's such a touchy subject, right? Um, there's long-term care insurance, right? And hardly anybody has that. I mean, nowadays, I don't really hear of anybody having long-term care insurance. What is your experience? Do people typically come in with that? What does that look like? And why is it so
I,
confusing for families?
well, I mean, you're specifying long-term care insurance, so that I hardly see it as well in my setting. In home
Yeah,
care, I saw it a lot
yeah,
because, your typical John Hancocks or what have you, they'll typically pay for caregiving services or assisted living.
yeah.
So I don't see too many, and it doesn't really come into play in the skilled nursing setting
Okay.
as often. I've probably only seen less than five, over the years. So insurance, so everyone has primary
Mhm.
health coverage. The majority, especially over the age of 65, you're going to have Medicare. So a lot of people are choosing. Obviously, people get inundated with options, of managed Medicare. I don't have managed Medicare, but what I assume is that it's a lower monthly cost. So if someone goes with United Healthcare to manage the Medicare
Mhm.
benefits, there's probably a lower monthly cost. There may be co-pays. And so you're dealing with managed Medicare system, and you have to make the best decisions, for that individual. So the majority of the managed Medicare, they're going to have Medicare has skilled nursing
Mhm.
benefits. So
Mhm.
That's not a question. Sometimes a copay, comes into play. So that's, again, it's primary health coverage. And, we're probably talking, a lot of us younger ones, we may be in the Kaiser system, or we may have commercial plans and everything. So again, most people that are over the age of 65 have Medicare. And then you can choose, the Medicare managed options. That's your primary. And so, specific to skilled nursing, Medicare will cover 100% up to day 21. So, day 21, there's a 100-day benefit period under Medicare. So, day 21 to day 100, there's typically a copay. Now, if someone has managed Medicare, there may be a copay differential. So we obviously, everyone's insurance and benefits are checked, sometimes even before actually always before they admit to my skilled nursing facility. Because sometimes we have to explain to patients, they may have a high share of cost, right? They
Right.
may have already spent a couple weeks. The rule is that if they're rehospitalized within 60 days, that means that you're restarting your skilled nursing benefit on the day of whatever you left. So if you spent 14 days, or even if you spent 20 days in another skilled nursing facility, within 60 days you need skilled nursing again, you're going to be admitting on day 21 where the copay is expected. So a lot of people may have anywhere from a $10 copay to a $200 a day copay. So that's something to pay attention to as well. So that's your primary coverage. So what's really important is that when people don't have a secondary insurance, then that copay is going to fall on you as private pay out of pocket.
Right.
And some people may have the large out of pocket, amounts. And so that's something to educate yourself on, for anyone to be
Mm-hmm.
educated on, is how your
Yeah.
insurance lays out. What's your primary coverage? Do you have secondary coverage? So since the pandemic, we've also noticed that the Medi-Cal system has changed. So there are more people that can meet criteria that never used to before. Like these are a lot of families that we would know, that we're neighbors with. So we're
Mm-hmm.
not talking about low income. We're talking about your average, consumer. You're talking about someone who's been retired for over 20 years, so they may not have a lot of income coming in, but they could have more than 2,000 coming in a month. It could be up to 5,000 a month. We actually had a gentleman that had, I think, over $7,000 a month of income coming in, and he's still qualified for Medi-Cal.
Wow.
There's a high share of cost, but in the long run, for long-term care, that's still a lot less expensive. Meaning, this gentleman had I think he may have had like a $6,000 share of cost, meaning you have to front the $6,000 if you're staying in a skilled nursing facility.
Uh-huh.
As soon as that first day of the new month hits, a share of cost has to be paid no matter how many days you stay in that facility. It has to be paid. So $6,000 is still a lot less expensive than private pay. Ours is ballpark 425 a day, which averages out to between, what, 10 and $12,000 a month. So
Mm-hmm.
those are the numbers that everyone's dealing. So it's always advisable to have a secondary insurance, and then those individuals, those that can qualify for Medi-Cal have the secondary or the tertiary. There's some people that have primary, secondary, like a Medicare gap, and then
Yep.
their tertiary in coverage is Medi-Cal.
Mm.
That is the way to go. And that way you're covered no matter what happens. And that's what I highly recommend, and people should be looking into that now just to prepare.
Yeah.
Yeah, because
Listening
that's
to this,
probably when it comes to nursing. Yeah, yeah, it's like, I know
I
you
can
had
see why families
mentioned,
are like,
yeah, yeah, like that is just probably the most important advice I could give anyone. It's like it doesn't matter if everyone's healthy right now. You look at insurance coverage and what if those needs change, and it can happen overnight. You just never
yeah.
know. You know,
Mm-hmm.
Two things. It's not even insurance coverage. just in case someone has to stay in an environment like mine, like skilled nursing to long-term care, even
Yeah.
if it's just for 2 months or 6 months, that's fine, but they still need to be prepared with coverage, and secondly, it's like, what is your support system? Another thing, that families are caught off guard, patients are caught off guard.
Yep.
It's like, well, who's going to be helping you at home? Insurance doesn't cover skilled nursing, and when someone doesn't have Medi-Cal, and maybe they don't want to apply for Medi-Cal, then they have to go home. And that is
Hmm.
the another area that people are not prepared for, that they really should be. Meaning, be really nice to your kids and your nieces and nephews. Just because that's going to be your support system down the road,
Yeah.
or, some people have friends or, neighbors. Support system, it's so critical, is your
It-
home environment, what home do you live in? Do you have steps? It's like if anything needs to be fixed, down. But you need to have need to build a support system if you don't have one in place, and you need to make sure your home environment is as safe as possible.
Yes.
Advisable, a single level home, try to
Yep.
avoid steps, so downsizing, think about it, before anything bad happens.
Knowing what are my
Yeah, and
yeah.
I have a great example to share.
Okay.
Uh, there was there was a gentleman that called me end of December, a son, right? And so he had
Hmm.
been taking care of his mother with ALS, which is just a
Uh-huh.
devastating
Yeah.
disease. And they were reaching a point where they were really beyond their capability because, they're not trained medical staff. And
Hmm.
so I advised him, I said, okay, typically, if someone admits to my facility, it's like usually from a hospitalization. That would actually be key because I actually don't think she had Medi-Cal insurance at the
Mm.
time.
Yeah.
And so he heard me, and unfortunately, her condition, she declined. So she ended up being hospitalized. She had a feeding tube placed. And so then her Medicare Part A, would be covering skilled nursing services, And so the son had already had my contact information. So he reached out to me and said, my mother's in the hospital. It's like, okay, so we'll be prepared for her admission, when she's discharged from the hospital. So I already knew that she was going to be a long-term care
Mm.
individual, right? And so
Hmm.
that was very smart. Well, we were very kind because it's a very difficult condition as well. So, but I was able to handhold the son, through that transition. So we have been taking care of her for the last 6 months. And yeah, so
It's
it's,
awesome.
yeah. So people can make phone calls in advance,
Yeah. Yeah.
and anyone's actually welcome to contact me or even come by the facility, because gosh, I've encountered thousands of scenarios, so I can always advise people appropriately,
Yep.
on what the steps would be, just for them to prepare as best as possible. So, and we're in the hospital case managers know that we do go above and beyond and that we will take care of individuals, especially if the discharge planning is questionable. Like we just don't know, what
Hmm.
direction this person's going into. It's like, that's okay. We'll take care of it. We'll find out what's going on and, and we'll help them through this process. So, yeah.
That's awesome.
And oh my goodness, just advocacy. I have to give you another example of advocacy. So we had another family. uh, I had a nurse case manager from the emergency department, at John
Hmm.
Muir, call me about 2 weeks ago saying, hey, got a little lady here, that went to Mexico for vacation, fell, broke her hip, had it repaired, and she can't go home. They cannot take care of her. They cannot manage her at home. So I'm like, oh, it's
Oh
like, you know what?
no.
I trust you. Let's take care of this little lady. So we ended up admitting her after 9 o'clock at night.
Oh
She
my.
came into my facility.
Yeah.
Unfortunately, unfortunately, there was no insurance that would pay, so it would be private pay, and then we would provide therapy under her Medicare Part B. The talk about a family overwhelmed.
Yeah.
So they're like, we were not expecting this, and everyone thinks that insurance going to cover skilled nursing, and it's like, no, not under these circumstances, because she may have had a hospitalization, but it was out of country. It was out of the country. So that
Mm,
doesn't, unfortunately, that, doesn't meet criteria for Medicare to cover. So the family was really frustrated about that. Well, unexpectedly, obviously she's under our care for nursing for rehabilitation, and her condition was worsening. So the hip was
oh,
not doing well. So I went above and beyond. The family wanted to take her back to the hospital. I said, wait a minute. It's like, let me reach out to my surgeons, my ortho, because ortho is our number one area of expertise. This lady had the hip surgery. And I managed to work with, one of the trauma PAs, and we ended up scheduling a surgery, for a hip revision. And we
wow.
got that done within 48 hours of the son's concern. And so she was readmitted, had the surgery, and we'll be admitting her back under her Medicare Part A. And I'm making sure, that all that criteria is met to make sure
Hmm.
that the family doesn't have to worry about insurance coverage. So I've been hand-holding through this whole scenario. So
Oh
that
my
is talk
goodness.
about the epitome of patient advocacy. Yeah,
Yes. Gosh, what a
yeah,
blessing. You're just like a
yeah.
little, I'm sure you have so many stories.
Mhm.
Boy,
And I'm grateful for all the professionals that I work with. It really is. It's community partnership at the end of the
yep.
day. It's like we care about the people, we want to minimize, like we want quality of life for everyone.
Hmm.
We want to minimize just wasted time in an emergency department and
Yep.
everything. So this is true community partnership, true community
Yeah.
partnership. Great question. So, one of the aspects of skilled nursing that it plays a significant role in an individual's life, especially if you're over the age of 70, is the
Hmm.
rehabilitation. It's the physical
Hmm.
therapy, it's the
Yeah.
occupational therapy. And so, what a lot of people don't realize is that someone may have a hospitalization, they may have had to go to the hospital, and maybe it
Hmm.
was seemed appropriate for them to return home, but maybe they're struggling a little bit. If it's Medicare, and even managed, actually, even commercial or managed, if it's Medicare within a 30-day window, a skilled nursing facility can admit them under that initial hospitalization, the three overnight, the inpatient overnight. We can
Hmm.
admit them within 30-day window and provide the therapy. And there's a huge difference. So when people discharge home, maybe under home health or outpatient rehab, it's maximum 3 visits a week, and you're lucky if you'll get 45 minutes of therapy. 3 visits. So, under skilled nursing rehabilitation, it's 5 days a week, 2 disciplines. So, it's typically,
Oh,
5 days of physical therapy and minimum of 2 days of occupational therapy, depending on what the needs are. So, it's apples and oranges when it comes to
yeah.
rehabilitation and the therapy piece to strengthen an individual. So a lot of people don't realize that. So there's the 30-day window. If someone has managed Medicare or a commercial plan, we can actually initiate authorization for admission to skilled nursing. So people don't have to rely on just home health or outpatient if it's appropriate, like especially if someone's had a stroke, especially if there's a significant condition change, they could be very well appropriate, especially if they're struggling at home, and again, it's the strengthening, it's the medical monitoring,
Yeah.
24/7 nursing, just to, we're always striving for highest quality of life for an individual. So a lot of people don't realize that. So yeah, my quickest admission from home, because a lot of our ortho surgeons know that we do this, and so I
Uh-huh.
had one of our top ortho surgeons, Dr. John Cronick. He had one of his patients in his office. So the gentleman ended up discharging home with his 80-year-old aunt, who he thought that would be a good caregiver. Well,
Wow.
care needs exceeded her capability. And so when he went for his post-op, Dr. Chronic was like, this is not working. And he
No.
immediately messaged me. He's like, is there any way you can admit him? And sure enough, with it, I said, have his friend drop him off and we'll figure it out. And that's what happened. So right from the post-op appointment, he was dropped off in our lobby and he had managed Medicare and I called my people, who were managing that medical group. I'm like, "Hey, I got so and so. We need authorization." Had it done within 2 hours and we admitted him.
Oh my gosh.
So that's
That's amazing.
probably, yeah, that's probably, yeah, that's a lot of community partners may not know that, but we can do it. We can do that.
I love it.
I mean, I think it's just going back to again being prepared, for the aging process.
Yeah.
It's who's your support system, make friends with your neighbors or what have you, create the home environment, so if it's really important, if an individual, if a family, if their and I so promote quality of life. Every day I say it to someone.
Yeah.
What is the highest quality of life in this scenario? That's what we need to revolve around. What are you capable of managing? That's what we need to revolve this around. That's how we need to move forward with planning. But what is the home environment like? Does this person who's been in their home for 50 years, do they want to stay there forever? Then you need to prepare appropriately. You need to reach out. There could be caregivers, that friends have used in the past or what have you that, could help. There could be family members that it's possible for a granddaughter to move in, to the home and maybe she can go to school out here or something at the same time, right? So it's really thinking about that now. It's preparing the home environment. It's preparing your support system. Most important, your health. I mean, people really need to take
Yeah.
a look at their own health and well-being. What
Mhm.
decisions are you making? Are you in the best, health possible? If not,
Yeah.
what changes can you make, so that you don't end up in the hospital or you don't have a day where, you're not able to walk.
Mhm.
Unfortunately, diabetes is one of the top, diseases that, people, sorry, but, a lot of it, diabetes, the diabetes 2, type 2, I almost want to say 90% of that's controllable. So
Mm.
that's the diet,
Yeah.
that's the exercise, right? Because a
Yeah.
lot of adults end up developing that because they're not taking care of themselves. So
Yeah.
that would be number one, take care of yourself, diet, exercise, really take a look at that, because boy, it'd be just easy if you just stay out of the hospital, period,
Mhm.
right? Home
Mhm.
environment, safety, right? And just making sure that, it's like the exercise, the strengthening, making sure that, you are stable when you're walking, as you age. Home environment, you may have to downgrade, your home, single story or what have you, or move in with family. A lot of family, there's just loving kids or grandkids that'll take, their loved ones in, and that's okay, accept the help,
Yeah.
and make that plan. So that would be make the biggest difference in people's lives. Just being prepared and, having a support system in place.
Love that. Be forward thinking, be prepared, have a plan, start looking at your health, take care of yourself, and get all the support you can. Accept it, don't push it away. That's great words of advice. Cam, thank you so much for being with us today. I mean, think everything you've shared with us is so insightful. I think after people listening to this, they're going to have a totally different outlook on what rehabilitation looks like, on the different types of services you can offer, and what advocacy really, really is. Thank you.
Thank you so much for having me, and I agree with you. If this is a, a way that we can tell 100 people or 1,000 people, then I embrace that. It's like this is a difference that we want to make in people's lives.